Welcome to In Heels with Keni Silva. In today's episode, we're going to talk about everything from fertility, surrogacy, and the journey to parenthood. And today we have Dr. Arnold, a fertility specialist who I actually personally know because I hate when people put expiration dates to women. And I hate that a woman has biological clock. So I wanted to have an option, even when I'm 50 or 60 and they, prolong the lives to 130, I wanted to have that option of having a child. And that's why I came to Dr. Arnold.
Well, thank you for having me. It's great to be here.
Thank you.
50 or 60, we're getting aspirational here,
Exactly. Well, at least I want to have an option. It's like, I might never execute it. It's like buying a bag. Doesn't mean I'm going to wear it, but I want to have it.
Have the option.
Same thing.
Yep.
Right?
Fair enough, fair enough. There are just so many different ways to do it these days. There's so many paths, and fertility is so crucial in so many people's lives and their relationships. And so it's great to chat with you about this. I think that your audience is going to be facing a lot of these issues, whether they know that they're going to be facing them or not. So
I feel like these days fertility is not just about the people who actually cannot have a child. It's more of a planning of the family, of having a child in general, because I know so many people now, they're not even married and they want to have a kid.
Yeah.
And I feel like it's much harder to find a husband or a wife versus having a child. It becomes like, if you want to get a dog, you go and get a dog. The same thing now with kids, right?
Right. And I mean, I think, this whole idea of planning, that really hits a nail on the head, because actually that's where a lot of fertility issues in the current generation have come from, whether it's not being able to get pregnant because everything had to be planned at a very specific point when you were ready, the right time, or whether you are thinking about the future and saying, look, like I want to make sure that I have the chance to have a baby when I want to have it, as opposed to when I'm supposed to have it, or when biology says, I need to have it. And then of course there's that other category of people who are saying, you know what, I'm going to plan it on my own. I'm going to do this on my own journey, in my own time, when I feel like doing it, without a partner. And that's an interesting group that's growing actually as well. So a lot of interesting ways to do it.
I feel like it's a lot more and more. I even know so many, I have a girlfriend, she got divorced, she already has 2 kids, and then she decided, you know what, I want to have another child by myself.
Yes, and I have to say, like, I have so many people now, single men and single women, who are coming to me saying, look, I just want to have this baby on my own. I want to, for men, they're finding an egg donor, they're finding a surrogate to carry the baby. And they're basically doing the whole journey independently. For women, sometimes they will carry it themselves, and sometimes even if they're a bit older and they feel the pregnancy isn't something they want to go through, they'll get a surrogate as well. So third-party reproduction has made it possible to do a lot of things on your own that you couldn't do on your own before.
So, okay, I want to know. So when they come in, a man or a woman, who has more wants on their list for the baby, man or woman?
It's funny, in terms of the characteristics of the baby,
like
what they
how
want.
does it even work? Like, I would imagine if before you just say, I want to have a baby, I need like sperm or donor or egg donor, they would just give whatever grading they have. Because I know, because I went through that journey, they have grading, A+, A-, correct? So they would give you the best of the best. But I guess these days, it's like a profile, it's like a dating app for baby mamas, for eggs, or sperm. How does this work?
People get pretty specific, like I have some clients who have lived their lives being able to order exactly what they want, and it comes exactly as they wanted it. And you have those kind of people who apply that to the eggs they want as well. So I have one person right now who's looking for eggs. And you won't believe me if I tell you these specifics. He's like, this person has to be on an athletic team at MIT.
Wow.
She needs to be beautiful, and he has some specifications around her race as well. And it just sounds insane, right?
Wait, okay, so first of all, when they come in with those, this is absolutely legal, right? It's like
totally legal, totally allowed. And as a woman, if you want to sell your eggs to somebody like that,
So they can
empowered to
sell
do
it.
that.
Like if somebody, instead of being on OnlyFans, they just want to drop their eggs, that's normal.
Honestly, it's 100%.
Oh my God, now I know what I want to do with those eggs I was thinking to freeze for the future. I'm just going to be selling them because I think I can get a lot.
Yeah, you do well. You do well.
This is my next line of business. Anyway, so once they determine that egg looks good,
Yeah.
but there's obviously no guarantee.
Well,
If they're using his sperm, it still might not look exactly what they ordered.
Exactly. So by guarantee, I was wondering what you mean, whether it's a guarantee of birth.
Meaning
but it's
like
gonna
my
have
kids look more like me versus my
Right.
ex-husband. So
Right.
even you order all the things you want, it still
Right.
might end up looking like that person. Then you're like, who are these?
That's right. I mean,
Can I take that? Is there
right,
like
right.
a return policy?
But I paid all this money, and now I
I
have
paid all
something
this
that's just
money.
like me. I didn't like me.
This doesn't look like me.
Well,
it's
I
not a
mean-
special order. I could have done this for free.
Well, I mean, the one good thing is, sometimes these people tend to be quite narcissistic, so it's actually fine if it looks like them. They're okay with that. But no, I'm just kidding. No,
Hey, listen, if you get that specific, you are in that
a little
category.
bit leaning in that direction. No, I think that the thing is, you're absolutely right. And that's why I try and actually encourage people not to be so wildly specific, because.
Yes.
Because also, if you want to get into it, a lot of the traits that lead to someone being an extreme outlier in certain ways can also lead to, kind of the wrong way, leading to traits you might not want in your child. Like I went to an Ivy League school, right? That means that I'm very kind of weird in a way, like I'm very into books and I'll like read all the time. And it's like, if that went a different way, you got a kid that you don't actually want,
Okay, wait. So about that, like I know that's like if you have blue eyes, everybody in the family,
Right.
your kid has more chance to get blue eyes.
Right,
If
right.
everybody in your family went to MIT, does that
Right.
mean that your kid will have higher IQ?
Intelligence has a component of heritability, so it does.
Yeah, but that saying that they always say that the kids of genius, like
Right.
like we have it in Russia, that the genius kids, the nature is like letting it go, meaning like if you look at every successful person, most of their kids don't do well.
Well, that's a motivation thing, right? So then we
Okay.
get to the nature
But
versus
genetically,
nurture.
they're wired to have higher IQ if they're both parents.
Yes, I think
Okay.
that's generally accepted. I think that the issue that you're talking about is more of a nurture thing. So
Yeah.
there's nature and nurture, right?
Got it.
So
okay.
once you come
So
out,
you have to also
and the
tell them this.
environment-
Hey, just because they went to MIT doesn't mean your kid will go.
Exactly. Yeah, you got to be like, you got to kind of handle it right with the parenting, right? But
Yeah.
no, I think people have unrealistic expectations a little bit sometimes, but sometimes it works out well because of course, if you want something a certain way and you want
Yeah.
it to be, if you want someone who's very physically attractive, right? There's a higher chance your children will be attractive. I mean, it's not a guarantee, right?
Yes.
Especially depends on what you look like to some degree,
Yes.
but there's a higher chance, and so people do try and order up a great egg donor and order up a baby. It is a little bit dystopian, it's a little bit weird, but it's definitely happening. And people, at some level, the women who are selling the eggs, they should have the right to do that. They should be able to do that if they want. And people who are on the other end, they also probably have a similar right.
If there's a demand, there has to be people that provide that. So I'm all about it. I'm
Yeah.
all about options of people using their body for whatever they want.
Right.
Because
Right.
at the end of the day, it's mine. Why I have to ask somebody what to do with this?
Right, and
it's-
this is controversial too. I mean, some people don't. Obviously, when we talk about it, we're making light of it because we're having a conversation. But
Yes.
it's a big thing, that people are doing, giving up their eggs and their child growing up in a different family, which is their biological child at least. It's not their legal child.
Yes.
And then there's the question about the women who carry the pregnancy.
That's actually the one I wanted
Yeah.
because I feel like because I carry two children and
Yeah.
even if it's not mine, but having it for 9 months, you create that attachment.
Right.
You create that
Right.
emotional thing. You feel them. They become a part of you.
Right. No. And I think that this is the controversy, right? Because on the one hand, what you're saying is true, and many women who have carried a child, I was talking to my wife about this on the way here, will feel that way. But I also have many patients who have not carried their children because of, sometimes
Yeah.
medical reasons.
Yes.
Sometimes because they didn't want to. That's also there, right? But sometimes because it's a medical thing, they can't actually do it. And I haven't seen anyone feel less attached to the child, because so much of parenting, and this is something that
well,
I
I'm
talked
not
about.
talking about the parent when they see
Well,
their kid.
right,
I know
of
it's an
course.
instinct. It's like
right.
I love, my daughter was my
Right.
firstborn, and
Right.
like I was like, wow, can I really love two kids the same way? So the moment I
Right.
saw my son, I loved him the same way. I'm not talking
Right.
about the parents love their kids unconditionally, even if
Right.
they didn't care. But I'm just curious, when that woman. What
the one carrying,
the one carrying the
she feels that
baby,
connection.
that
I
feels
see.
that connection,
You're right.
like, because I know there's a surrogacy law. There's so many, I think, in California, so many days they can be with that baby, right? Or no, or it all changes, because not all countries have
Right.
that. There's a surrogacy law. There's so many, I think, in California, so many days they can be with that baby, right? Or no, or it all changes, because not all countries have
Right.
that.
So in California, you can do pre-birth orders, and so some states
What
have
is
that.
pre-birth
so
order?
what this is means that the baby, before the baby is even born, is already the child of the intended parents. So it means that as soon as the baby comes out, from that moment on,
Okay,
it's
so
no
she has
longer-
no rights.
She has no rights to the baby.
Is
that's
she on a
right.
birth certificate or no?
No, not
So-
in states that have this thing.
Oh, so it's
Yeah.
not every state.
No, some
Okay,
states.
so what is the best state? California?
California by far.
Okay, so if you want to have a surrogate mother, come to California to deliver to Dr. Arnold. He will
Right.
help you out.
Yeah.
Because that's what I've heard. My girlfriend who
Right.
used surrogate in the past and then went somewhere outside the country. She's
Yeah.
like, I don't want another woman have my child for 30 days or whatever
Well,
it was.
so in other countries, even in other states, the laws can be different on that. So the surrogate can change their mind and things like that.
Yes.
Which is something, that's a nightmare you do not want to
even if
even
it's
dream
not
about.
her embryo, like
Even-
there's nothing
That's right.
except that baby, she can still keep it.
In certain jurisdictions.
yes.
So
Wow.
we obviously don't deal with any of those jurisdictions.
Yes.
Because who needs those kind of problems, right? But in many states in the
California, yeah.
U.S., California being one of them, you can have pre-birth orders, and so I generally will only deal with surrogates who are from those states, and we have surrogates who are not just
Oh, wait,
in
when
California.
you're saying from those states, she has to live in California.
No, she doesn't have to. So we actually deal with surrogates all around the country, as
Okay.
long as the state laws are appropriate and amenable to this process.
Okay, got
Yeah.
it. But she has to deliver in California?
No, she
Anywhere?
can deliver in her home state.
Okay.
Well, not at any state, because remember, every
Yes,
state
yes,
is different,
yes. The
right?
state that
So
has
the
that
state-
pre-order, whatever you
That's
called
right,
it.
the pre-birth
Okay,
order, yeah.
pre-birth, and her name. So when that child is born,
Yeah.
it's just the parents.
It's the intended parent's child
Okay.
from that point. So it's, of course, it's an important thing. I think in practice, I know in theory it's like, well, the surrogate must have this attachment and this bond. I've never actually seen in practice that it's been a major issue. And I
Okay.
actually, I like to have a relationship with the surrogates who are in the clinic. I like to be involved and just really know their story and know how they feel about everything. Because I think it makes me a better doctor to do that. And my experience has been that surrogates are really pretty, no one has really told me, I just really felt this thing strongly where I wanted to keep the
see.
baby. I just haven't had that happen. Now, I suppose in theory it could come up where people would feel more attached, but mostly, these individuals are kind of coming into this for a reason. They really understand really well. We make sure they're really well informed and they understand what they're getting into. And I also, like myself, there are agencies who they come through a lot of the time. But I will myself, kind of vet them and make sure that they're really clear on what's happening, make sure they really understand. And I won't kind of, involve a surrogate who potentially would feel that way. Because I think it's a very bad thing for both her as well as the intended parents. So,
Can the parents visit her during pregnancy, or let's say I want you to be eating only organic food, or I
Yeah.
don't want you to over-exercise?
Yeah,
or
it's a big
is
thing.
there certain limitations that?
right, and so this gets into how much control should you
Yes.
have, and of course intended parents, a lot of the time they want to have a lot of control. As you can imagine, if your baby
Yeah,
was in
it's
someone else.
it's already there.
No, you're gonna want that control.
If somebody
we-
gets drunk, I mean, God forbid.
I
It's
know.
but things happen. This is 9 months process. This is
It's-
not even 10 days.
It's a long time. So, things like drug testing for smoking, things like that, we, do routinely because it's something that's very, very important, and we need to do it at a frequency to make sure that nothing is happening. generally, we're not at risk of that because we've picked the person very carefully. But we have to be sure and we have to be careful. The food thing and the sleep and the exercise, this is actually a very interesting kind of area because people always want their surrogate to eat certain thing. And I mean, even if they were pregnant, they might go to Chick-fil-A a few times. But when the surrogate's
I had
pregnant,
sushi. I wanted sushi and oyster so bad, and my doctor said, as long as you eat it at a good place, you're good. You're safe.
Yeah. No, it is. Yeah. I mean,
don't do, like sushi from a
street food or
store.
something,
Yes,
yeah.
exactly.
Yeah.
But it was my child, my responsibility. You
Right,
know, like
so you
I don't have
could-
to answer it to anybody.
Exactly. And so you.
This is different. This is your
different.
job.
Right. And so, I have encountered scenarios where the surrogate, wants to eat for what they want to eat, right? And the intended parent's like, I don't really want the surrogate eating all this stuff, right? And the thing with how a fetus develops is that most of the time the fetus is essentially like a parasite. It just takes what it needs and leaves what it doesn't need, and for the most part, it self-regulates. Now, of course, if you're eating really badly and you're developing, for example, gestational diabetes, and because
Yes.
which your diet contributes
That's where
to.
it's like, what if
then
that
it can
person
impact.
has, okay, so if she
Yeah.
has underlying conditions that were not discovered before,
Well,
that
it
can
would be-
affect.
I mean, in theory, it would be very
Okay.
unlikely that
Okay,
I
got
wouldn't
it.
that there would be something I wouldn't see. It's be very, very
So
rare.
you actually see, oh yes,
Oh yeah, I'm
yes,
doing all the
because you're
medical.
implanting.
That's right. I'm doing all the
Okay.
medical screening. I'm making sure that
Okay.
medically we're okay. But I do have an approach. In some cases, the surrogate parent and the intended parent both want to do this approach, where the surrogate will do some kind of tracking, and
Okay.
so there are continuous glucose monitors. There are the Aurora ring, stuff like that, right? The Apple Watch, which will help track things like sleep, exercise, steps, and even glucose spikes and things like that. So we, we never would impose that on any surrogate. We'd never, be like, you have to do this because your intended parent wants to keep you in
Yes.
jail or something. Like that's not how this works, right?
Yes.
But in some cases, both sides, they really want some sort of tracking and accountability, and the surrogate is very open to that. And it kind of helps as well when you're trying to live a healthy life. I know people who are wearing glucose monitors and Oura rings for themselves, just to like try.
Those probably the ones who ordered those babies. Like, hey, I'm not.
Maybe some people like that.
Wait, what about the delivery? How they deliver the baby? Can they dictate C-section versus natural? Because you as a
Right.
doctor know that during natural delivery, there can be so many complications that a child can just die.
No, it's interesting. You're hitting on a lot of the things that we actually face without knowing the subject. It's interesting.
Well, what do you mean? I am a mother of two. I went through a lot. So
No, I
I
mean
had two
this.
C-sections, and my fetus was hyper fetus. Every week she would turn.
Right.
And
so
because I'm so a planner, I was
Right.
finishing my fit, and
Right.
Thursday I had finals, Friday I scheduled. I'm like, hey, I'm
Right,
not going to
right.
let her control my
Yeah.
life. I'm all about planning. That's why I'm like, I
Okay.
love this.
Well, so we're clear. I wasn't questioning you knowing how to be a mother.
No, I know,
obviously.
but
I
it's
was
just-
saying the surrogacy journey itself.
No, I'm just.
But no, I know. So the surrogacy. So yes, the question about like delivery, what you do around the time of delivery, about sort of what happens in those first moments after birth if there's an issue of some kind. So I actually recently had an intended parent ask, I want to modify the agreement because I want to be, in case the hospital doesn't allow multiple people in the room, sometimes they only allow just the husband to support the surrogate. She's like, I want to be in the room because in case there's something that goes wrong, if I have to make last minute decisions around what happens and how they intervene with the baby.
Oh, so it's legal. So these parents make a legal decision for the child if
Well-
something happens,
Well,
right?
so the thing I explained,
Or-
thing I explained to her was, it's not going to, like the medical team is going to do what they need to do.
Exactly.
They're not
This
going to
is-
stop and say,
Yeah.
before we, resuscitate this baby, what is your opinion?
Exactly.
Right? They're
Yes.
not going to
It's
do
not
that.
like Jehovah's Witness. Like, can we do a blood transfusion? No, you cannot. Okay,
Well-
this is just a baby.
Well, they're not going to pause and ask you those questions. They're going to,
Yes.
they're going to manage things. But like essentially, when it comes to delivery, we do need to kind of make sure people are clear because people do want to, the point I was making is people do want to have these unrealistic levels of control sometimes
Yes.
on a process that actually doesn't involve them until the child is born. And so, yes, we do what's medically right for the surrogate. So if the surrogates can deliver vaginally, we do it that way. If she needs a C-section, it's done that way.
But
doesn't
can
have
they
any
say it
involvement.
up front, like, hey, I want her to deliver C-section. I want my child to go through a birth, stress?
Yeah.
Because it is a stress for the baby.
No,
No?
I don't.
Ah.
They wouldn't have the right to do that. Yeah.
Okay, so there's no.
I haven't had that come up actually. It's interesting.
Okay.
I'm sure it'll happen now that you mentioned it.
my ex-husband
I'm
is
sure
a
you'll
doctor,
mention-
so I've heard so many stories about complicated
Birth
birth
trauma,
deliveries,
yeah.
birth trauma, how people
Yeah.
end up like from paralyzed to this to that. I was
Right.
like, oh my God, like.
But remember,
If I paid so much money, I want to make sure
wanna make
this is
sure.
wrapped in a bow.
No, it's a fair point, and I'm surprised it hasn't come up. It'll definitely come up now next week, I'm sure. But these people we're selecting to do this process, they've already proven to be really good at giving birth. So
so
they have
this
to have
is
given
not
birth
their.
before.
So this is not their. It's
Absolutely not.
Okay.
Yeah, never their first
How
time.
many times a woman can actually do this? You
Uh,
think for
to carry a baby?
Yes.
There are some guidelines that are issued by our professional societies,
Okay.
and then there are some flexibility they allow us if we medically consider it to be appropriate. But generally, we say that once you get to sort of 4 or 5 births in total, that we're starting to
Okay.
get into higher risk categories.
Okay.
So you would have one of your own, and you could carry probably 3 surrogate journeys, and you'd be okay. Sometimes we're allowed more based on the guideline, but it's really a case-by-case thing after that.
And
So
is it also like age and everything related?
age, health issues, all of that factors in. So there are some places that use like a very strict guideline list. They're like check mark, check mark, check mark. I do it on a clinical assessment basis. So I
Okay.
look at the overall picture and I'll say, is this person safe to carry a pregnancy? In some cases, if you're 5'8" and your BMI, your body mass index, is like a little bit higher than what the technical cutoff is, but you're obviously healthy, right? I say those cases are fine to proceed. So I allow some flexibility based on what's medically appropriate, which, our professional bodies do allow. And some places are very rigid and stringent with the check marks. So
Yeah.
it can vary, is what I'm saying. But
Yeah.
generally speaking, there are pretty clear criteria, and we make sure the person is very healthy. But generally speaking, there are pretty clear criteria, and we make sure the person is very healthy. In Canada, actually, surrogacy has to be done altruistically.
What
so
does that mean?
So it means you have to do it for free, effectively. Like you can have your expenses covered,
Ah.
but you can't get paid.
Got
And so I'm
it.
board certified in both Canada and the U.S.
Okay.
And I practiced in Canada for a few years. So
Wow, so everybody who wants it for free, they can go to Canada. Or you have to be a resident.
well, you got to find a surrogate who'll do it. I mean, not everyone's so it's hard to
I
find a
see.
surrogate.
Okay.
So it takes a long time to find one.
I
But
see.
the reason I raised that is because you asked about the criteria. In Canada,
Yes.
oftentimes we're working with surrogates who are less medically
I got it because
Optimal.
it's just
'cause it's
less
whoever
available.
less available.
bodies to do that. Wait, how many embryos do you usually put? 1, 2? Is there a limit?
So-
How many? You remember that
Yeah.
show Octomom that the doctor went to?
We definitely want to avoid that. Definitely want to avoid that. We don't want to be famous for doing that. No, it's generally 1 embryo is what is most appropriate. Twin pregnancies can be higher risk, and so we generally want to avoid that. There is discretion though. So some places will be more strict on the 1 embryo. Some places will be a little bit less. I would say, for me, I look at the overall clinical picture, and if the intended parent really wants to, and the surrogate really understands the risks, I am comfortable with doing 2, but that's not true for everyone. So I think,
Got
1 embryo as a rule, but again, like you have to use your judgment. The thing is, like my practice is very, boutique, very personalized, very private. So I'm involved in every step directly.
Yeah.
I don't have like a million ultrasound people and nurses and things doing the management. So because I'm doing everything myself, I can be a little more flexible with things because I know what's going to be medically safe and not, right? Whereas if it's some other person, they have to go by a checklist more strictly because
Yeah.
they don't have that experience.
Well, and you want somebody, I think, when you go through that journey, it's such a personal journey. You want your doctor to be there every step.
It's very rare now. It's very rare.
You know, well, because
it's
it
rare.
becomes such a commercialized
become that.
thing. If before
Yeah.
people really went to fertility because they couldn't have kids,
Right.
especially being in Beverly Hills in California, this is
Yeah.
more becoming of made to order.
In some cases.
You know,
In some cases.
or just it's also because I feel like there is different nowadays couples that, you know, they cannot just have
Yeah.
kids because of their gender.
Yeah, they're both
you
men,
know,
for
so
example.
exactly,
Yeah, for
yes.
sure.
So they have to turn into that, or
Yeah.
even if it's two females,
Yeah.
they still have, you know, they need you.
Right, of course.
And but you know, I read that, and tell me if it's true or not,
Okay.
that I think it's China that's developing a body, a robot that can carry actually a baby.
Yeah, so I saw the research, or I saw the publication, or the claim.
Yes.
I will call it a claim.
Yes.
So there have been studies that have come out of that part of the world where, they, for example, CRISPR, they claim to have had a baby born from this technology. And CRISPR is how you can delete or edit a certain gene. So you can edit one gene. So if there's a disease-causing gene, you can just replace it with the right gene. And it is a technology, it is real, it exists.
Okay.
There was a claim that a baby was born from that, which was then proven to not actually have been the case. So I think—
So there was no babies born.
So
yet.
there wasn't one.
Okay,
yeah.
men just want to eliminate our gift of give birth and end life with us. They want to be fully in control.
Right.
That's how I feel,
Yeah.
because
So-
like, why would you do this? This is like, I mean—
I'm suspicious that that technology exists yet. So there's a very— for sure, once the blood vessels are all developed and it's a very premature baby, there are systems that are real, that exist in the US, that can carry that baby then to a viable gestational age. That baby otherwise would have passed away being too premature. So there are systems like that. And there are, you know, we can grow an embryo up to a couple of weeks, right? That also is the case. But bridging that gap between the embryo stage and then to the point where you have the blood vessels where you can plug it into a machine, that I don't believe has been surmounted. It requires a placenta, which is obviously the organ that attaches the baby to the uterus. And I don't, I looked into this. It's called ectogenesis, is this theoretical thing of creating, you know, genesis of a baby outside the body, ecto. So, but I don't believe it's actually, I personally don't believe it's actually happened, personally. But if it has, we'd know a lot more about it. So, but, you know, it's an interesting concept. I think the point you made earlier too about, you know, the journey being so personal is an important one. You know, it's actually very rare that your doctor actually sees you through your whole treatment and does the procedure themselves. It seems very obvious that that's how it should be. But increasingly, clinics are corporate and they're just like kind of running like assembly lines, and so like you don't get that experience as a patient going through it. But you know, like the one nice thing about being in a place like LA and in Beverly Hills is that you can run a clinic that way, and you know, people are you know, definitely receptive to that. Though I think honestly, anyone going through the journey probably benefit from it.
So now, since we talk about people who can just walk in and order their, you know, babies, I want to talk about the people who actually cannot have children for different reasons.
Of course.
And especially the ones who maybe had a medical, you know, they went through cancer or chemotherapy. Do those patients actually can have kids after being through chemotherapy, or like how does this—
Right, no, it's a very good question. It's a good question, and of course it's a topic that's close to you as well. You know? And you know, so the answer is it depends on what your body was actually put through. So certain chemotherapy regimens are more toxic to the ovaries than others. And so just because you had chemo doesn't mean that it affected the ovaries. Some regimens can completely damage the ovaries to the point where you go into premature menopause even.
Oh, wow.
And so, you know, things like pelvic radiation impact the ovaries significantly as well. So, you know, in cases where it's very case by case. So that's why there's now a lot more advocacy to try and preserve your fertility before doing treatments.
That's why I wanted to ask, if somebody finds out they have this health condition, can they freeze their eggs before they go into the chemotherapy if the time allows? Because sometimes you cannot, you have to, like, it's an urgency. But sometimes before all these things.
Yeah, no, we can, and we have all kinds of protocols now to be able to stimulate you at really any time of your cycle, so we can start right away, get what we can, and freeze it. It's something that, you know, has changed a lot of lives. You know, it was something that wasn't available as recently as maybe 20 years ago. You really couldn't do this successfully. Now we really can, and of course it's something that people, you know, should be made aware of that exists if they're in that position. And it's really one of those scenarios where egg freezing is really a godsend and really effective. I think that egg freezing has become a little bit oversold in terms of the promises that are being made about it. I feel that, being someone who's in the field. But that's one case where it's no debate at all. If you're in that position, it's definitely something you should consider.
What about men? I mean, we always talk about woman. It's not like it's always our problem why you cannot have a child. There's
of course not.
Obviously so many problems with men, I would imagine.
And they're
but nobody ever talks about it. It's always like our fault. But then at the end, you're like, well, you have a low sperm count, right? That's what it's called.
I mean, it's good you mentioned that, because there's a trend that's happening in the country where sperm counts are dropping over time, testosterone counts are dropping. We're having increasingly male factor infertility. The stats are that up to half of the cases in a fertility clinic are actually male factor.
Yay! It's not just us. We're not just yes, because
Exactly,
it's always brought up, and I'm like, wait a minute. It takes two to make a baby.
It for sure takes two, and we're also finding subtle male issues where even though the sperm counts might be there, once we actually try and, for example, doing IVF, we see that the embryos drop off from development, and we realize that it's a male factor thing.
Okay, yes.
Because it's a male issue, it's not just an egg quality issue. And so even if the sperm looks okay, the quality of the sperm matters too in terms of exposure to toxins, how you're living your life. It's mainly lifestyle stuff.
And for men.
For men. And then there are sort of antioxidant-based supplements that can help improve sperm quality as well. But a lot of it is lifestyle. A lot of it's lifestyle. And a lot of guys are now using testosterone. Guys are trying to be...
So it's bad?
It's terrible. Yeah, testosterone is basically male birth control, effectively.
Really?
Basically,
Oh, wow.
Yeah.
I had no idea. Okay, guys, so you have to be very careful.
It totally shuts... So what testosterone does is it shuts down the signal from the brain that stimulates the testicle to make sperm. And so when you shut that signal down, the testicle's like, all right, I'm done. And that's why you hear guys who take testosterone, they're like, oh, my testicles are shrinking.
I didn't know that either. Okay, got it. So I would imagine the same thing as with female infertility after being, through radiation or chemo, whatever, it affects them the same way.
Well, yes.
Or not. Or they have reproductive
difference,
serve, like how does...
So the difference is that sperm is regenerated from stem cells every 3 months or so. So they can, the sperm can bounce back. So if you stop taking testosterone, you sometimes take some meds to stimulate the testicle. Sperm counts can rebound, but sometimes they don't, right? And so this is the part that you got to be careful about. But I would say...
What about chemotherapy? Does that happen the same thing?
No. With chemo it doesn't. Yeah, and chemo can do permanent damage.
Okay.
And that's why it's so important for men too. If you're going to go through a treatment, freeze some sperm vials. And obviously that's much easier than it is for women to...
Yeah, of course. Like men can do it right before they go in.
It's pretty much, yeah.
But, okay, the question is, if somebody already knows they have cancer, but they're not with their treatment, will this affect their quality of sperm or egg or not? They're not with their treatment, will this affect their quality of sperm or egg or not?
Generally not. Okay. Generally not, because cancer, unless it's cancer that's affecting your reproductive organs, in which case this wouldn't generally be an option. It's normally at the stage where it's caught, it hasn't caused massive systemic disease yet. Yeah. And so because of that, the egg quality and sperm quality is pretty good.
And how these days, embryos can be tested for any genetic disease or anything that's right, and can that be tested with the embryo if you have certain,
genes that predispose to cancer? Yeah, so we can. So if you have a single gene that's predisposing you to cancer, we can screen that gene out. So it is something that we can do, like there are panels that you can do a blood test. They'll screen for a bunch of cancer-causing genes. If you carry something, we can then, from the embryo, we can select the embryos that do not have that gene. So you avoid passing that gene on. So it is definitely something
or like Alzheimer's or Parkinson, like those big...
Single gene disorders we can do. So they have to be a single gene disorder. So if it's a disorder that is caused by a single gene mutation, we can identify that gene mutation and then screen for embryos that don't have it. Certain illnesses are multifactorial, like diabetes. It's not one gene. So because of that, we can't just screen that out. It's like a multifactorial. Now that said, There are companies working on technology where you can profile clusters of genes, and you can look at what's called the SNP. It's like a profile of like a bunch of genes, and based on that, they're trying to be able to assess, things like intelligence, height.
Oh, even that?
Yeah, like risk of
wait, so
things like
now
that.
they can even see the height, like all
Well,
this.
they can. It's not great yet, right?
Okay.
And of course, you're kind of working with what you have. And I mean, someone asked me, "Oh, can you tell if, the kid's going to be tall?" And I was like, "Well, if you and your partner are like 5'5", the answer is no. The kid's not going to be tall, right?"
This is not a magic pill.
Right.
Can they insert with
insert
something
height
to make them a little bit taller? Can you stretch it?
Right. Yeah. So it's, I think what you could probably do.
But do you think it will be able to happen in the future?
So what I think can happen is you'll probably be able to screen among embryos you already have which genes are better represented from different sides of the family, for sure. So you'll be able to tell that. So if so let's say my family, everyone's really tall, then I'll be able to tell, okay, this embryo seems to have more representation of those genes, potentially. And then I think the other thing that you might be able to do is these SNP arrays might get good enough where you can see a cluster that predisposes to height, and then maybe you can order those embryos in terms of which might be more likely to be taller. I think this actually may be possible in some time, but not too long.
I mean, technology, even fertility business, like back then, it was not what it is now, and it's...
Well, it just wasn't successful before as much as it is now. I mean, like the fertility industry, like IVF is about 40 years old, approximately.
Okay, so it's not that long.
It's not that it's been that much time, and so that was the first baby was born at the place I did my fellowship training in Virginia at the Jones Institute. Well, the first baby in the US, I should say. England was the first baby of all time. That was pretty much 40 years, just over 40 years. And so, of course, for that technology to mature and for it to actually be offered more widely, add 10 years to that, and then add 10 years to that for things to evolve. And so really we're talking about IVF being done at a high level, probably for a couple of decades. I mean, like a little more than that, So.
And when you're saying at a high level, like what does that mean?
Like high success rates.
Oh, okay, got it. So high
success,
it's like the baby is the baby. It's not like the baby is now superhuman. It just is a success rates with, what
Yeah, like
can
in
be.
the early days, it would be like, the success rates were, 10%, 15%, like that, right? And now.
But it's also because in the early days, it's the people who really had problems, right? Or not?
More the technology wasn't good. Like in the early days, they actually did select the patients they wanted were the ones with the highest prognosis, who tended to be those who had like a fallopian tube problem. So it was just that the egg wasn't physically getting to the uterus.
Well, that's another question, actually. For people, because I mean, some people, when they have too many kids, they actually want to tie their tubes or men go and fix it. Is that reversible?
So yes, it is. There's a procedure, and I do that procedure myself, where we can
for men and for women.
Well, yeah. So men can get their vasectomy reversed. I don't do that, but for women, the fallopian tubes can be reconnected. But I was talking to some other surgeons who do that procedure, and they were sharing that it's actually becoming less and less common to actually have that happen, because the way that tubal ligations are done now, they're actually starting to remove the entire tube, so there's nothing left to connect. The reason is because we believe that ovarian cancer begins now in the fallopian tube. And so if you're having your tube, a piece of it removed, the idea is you may as well have the entire thing removed to totally decrease your cancer risk. So we're actually, I think...
So it's like preventative method if you have it in, or...
That's right. So now it's kind of become that way. So I think we're going to see tubal ligation, reversals being kind of a dying procedure. I don't think it's going to happen very much in a very short time.
But so then the woman cannot...
She can't have the tubes reversed, but she can do IVF.
She can do IVF and still have a baby.
Correct.
Okay, so there's all these options
There's
for women with no tubes.
There's always a path. There's always a path.
And that's why I love it. Like, you can still prevent from getting sick or having something traumatic, but still have that option of having a child.
Yeah.
It's and that's why I think it's so great to have the science and technology to this level, because now we're not just looking at reversing the tubing, we preventing something, but at the same time having an option,
Right, and I think that the point I'll add to that is, and I think it's not very widely spoken about, which is why I like to kind of bring it up, is this technology is much better. It's definitely it's very good compared to how it was. It is not perfect, and I think the part that the industry kind of doesn't underscore enough is that yes, you can freeze your eggs, and yes, it potentially will give you those options you're looking for. The technology is not perfect. It's very dependent on how many eggs you freeze, how old you were when you freeze them, and I think, and the reason I say this is because I see a lot of women who have a mistaken perception of what it will actually do. And even though they may have had, the fine print may have been on the contract, they didn't really perceive that or really take that in. And I think that
because I want you to actually specify, let's say you got 15 eggs. How many embryos out of those 15 eggs usually will come?
Sure.
So people understand, like, when you're saying all these things, like, what is this actually in the numbers?
Sure.
Why it's such a high, expectations, and then they're disappointed?
Right, sure. So, by the numbers, to have and this varies depending on the center and things like that, but to have about a 50% chance of live birth, which is not 100, 50, we say you need to freeze around 10 to 15 eggs at age 30.
Okay.
So I would say 10 is what the numbers say. By age 35, that goes up. We're talking 15 to 20. If we're talking about 40, in some studies, it's shown up to 40 eggs.
Got it. So it's the older you get, the less those eggs have a chance to, I don't want to say hatched, but how does it go?
To hatch. Yeah, no, it makes sense. No, it's
I don't know, what is the medical term? I don't sound...
No, it's fair enough. No, it's that the older you get, the more abnormal the eggs become, meaning the higher likelihood is that the eggs are abnormal.
Okay.
And egg quality drops as well.
Okay, let's say I'm a 30-year-old with 10 eggs. Like, how many embryos can I have from that?
So generally, the live birth, as I said, is about 50%.
Okay, so 5 embryos.
No. So the number of embryos you would get is probably, you're looking at maybe
3?
2 to
No
3.
way.
Yeah.
Wow.
2 to 3.
So out of 2 to 3, you might even have just one baby that will actually make it.
Correct. And
that's why I understand.
And there's an embryo transfer success rate. So, 60, 70% at a good clinic, but, you're still not 100, right? So, even if you get 4 embryos from your eggs, you're still looking at a chance that, you might not get pregnant. Now, it's not common that happens, right?
Yeah.
But I think that having some perspective on that it's not perfect is a good idea, and not taking it as like a license to be like, okay, well, now I've done this, the clinic sold me this thing, so now I get to not worry about anything ever again. Understanding that it's a backup, and that still your natural fertility is your strongest asset, and taking advantage of it, if you're in a position to, is always the best thing. Of course, if you're not in a position to, then we can do things to help, right? But I like to put that in there because I just think it's not well known, and I think a lot of women, they get the wrong message because obviously clinics are trying to move their cycles, right? So, yeah.
No, it's hard. And there's so many questions I want to ask, but unfortunately our show comes to an end. But I want you to tell me where people can find you and ask all those other questions, because you are so knowledgeable, and you definitely take that personal care that a lot of us would like to have during this, very scary process.
Of course, yeah. No, so I have a boutique concierge practice in Beverly Hills. You can find me at drarnold.com. That's my website. And my Instagram is @drarnoldmd. And you can DM me there. For any issues that you have in fertility, I'm always happy to help. Sometimes I'll respond to DMs and things. So feel free.
Thank you so much, Dr. Arnold.
Yeah.
Thank you.
Yeah, lovely to see you.
We'll be right back.